I'm Richard Mattis, Distinguished Professor of Nutrition Science at Purdue University. Yeah, so artificial sweeteners are chemicals that are especially potent at stimulating the sense of sweetness. And because they're so powerful, they're used in very, very low concentrations. As a result, they give sweetness without contributing much energy to the diet. So it's a way to reduce the energy content of food. I'm not a toxicologist, but this is a question that I get all the time because there is often a conflation between safety and efficacy in the use of these products. And my work is more on to what degree do these help with weight management. However, I'm very much aware of this literature on safety, and I would point out that every government agency around the planet, the Food and Drug Administration in the US, EFSA, the European Food Safety Association in Europe, similar agencies in Japan, Australia, and around the world have all uniformly determined that these compounds are safe when used at recommended levels, which would be true for any food ingredient. Some people believe that artificial sweeteners stimulate hunger. And that's really driven by the view that through evolutionary time, we've associated the sensory properties of foods with the metabolic consequence of consuming them. So sweetness, theoretically, is a signal for carbohydrate in the environment. Carbohydrate's an energy source, and so if we consume it, we should feel more full. And these low-calorie sweeteners provide that signal, that sweetness, but without the energy, so it creates a paradox to the body, and the assumption is that that would then lead to augmented hunger. However, objective science doesn't support that view. When people are tested with low-calorie sweeteners and nutritive sweeteners, the effects are very similar on hunger, except when people knowingly use a low-calorie sweetener. In that instance, they believe that they have saved energy, they shouldn't be as full, and so they may psychologically think, oh, I must be more hungry, and they report that. But when they're tested blindly, that's not supported. Our work suggests that they can be an aid in weight management. Weight gain is driven by many different factors. It can be low exercise, it can be the type of foods that people are eating, and so on. So it's hard to link a specific sweetener with a health outcome. However, what we find in our work is that it's probably incorrect to view all of the commercially available sweeteners as just variations on the same theme. Yes, they are all intensely sweet, so they provide sweetness without energy, but they're all unique chemicals, and they bind to the sweet receptor differently. They're digested differently. For example, aspartame, which is equal, the blue packet, is completely hydrolyzed, digested in the upper small intestine. Saccharin, sweet and low, the pink packet, that's absorbed into the bloodstream and excreted in the urine. Sucralose, which is Splenda, the yellow packet, that's not absorbed at all, excreted in the feces. So they have very different metabolic consequences. And what we find is that they may have different impacts on body weight. So in our hands, sucralose seems to be the best at weight management, saccharin the least. But I want to be very clear, this work has not been replicated. Not because people have tried and found different results, but because it just hasn't been tested again. So we need confirmation from an independent group to verify those findings.